Hey everyone, welcome back to the channel. If you are a nurse practitioner, or running your own healthcare practice, this one's for you. Let's be honest. Charting, answering phone calls, scheduling, prior authorizations, it never ends. The burnout is real. And that's why I wanted to share this exciting new video that I found on YouTube. It's going to completely transform the workflow as we get into AI and we get into robotics. NVIDIA actually has this nurse bot. It's called NurseBot. And it's an AI-powered assistant designed specifically for nurses and nurse practitioners. Now, my idea is that it's going to help assist us in our private practices. We can use it in the clinics, hospitals, and it's going to help automate like routine tasks. For example, answer patient questions, manage like schedules. It probably can do some documentation, maybe even answer call lights. But it's a 24/7 assistant that, it never calls in sick, right? It's actually HIPAA compliant and fully customized, and you can, for whatever unit you're on or whatever kind of practice you're in. So I'm just going to kind of show you this video, and we'll kind of talk through it. It's pretty interesting. All right, here we go.
Is now assisting real patients inside a working hospital. Not in a test lab, not in a concept video. Right now in Taiwan, NeuroBot, built by Foxconn, powered by NVIDIA's AI and engineered with Kawasaki Robotics, is monitoring vitals, helping with mobility, and even adapting to patient behavior in real time. It's one of the first AI-powered humanoids deployed in active clinical care, with global nursing shortages and aging populations accelerating. This may be the first glimpse of how hospitals will operate in the near future. Here's how it works, and why this is bigger than it looks. Why this matters now. Healthcare systems are under mounting pressure. The World Health Organization projects a global shortage of 10 million healthcare workers by 2030, with low- and middle-income countries hit hardest. In the U.S., the American Nurses Association has declared staffing levels a national crisis, driven by burnout, turnover, and rising demand. At the same time, the global population over 60 is expected to double to 2.1 billion by 2050. Hospitals are already stretched. Doubling the number of elderly patients will only intensify the strain. Until now, healthcare robots focused on back-end logistics, sterilizing tools, moving carts, restocking supplies. But that doesn't solve the frontline gap. That's where NeuroBot comes in. Built by Foxconn, powered by NVIDIA, and engineered with Kawasaki Robotics, it's designed to assist patients directly, monitoring vitals, helping with movement, and learning behavior, all inside a real operational hospital. This isn't theoretical anymore. It's a working response to a system nearing capacity. What is NeuroBot and who built it? NeuroBot is a full-sized humanoid robot built specifically for hospital use. It's the result of a multi-organization partnership bringing together hardware, robotics, and AI. Foxconn, the world's largest electronics manufacturer, handled the physical construction. Kawasaki Robotics contributed its automation expertise, drawing from decades in industrial robotics. But the intelligence powering NeuroBot comes from NVIDIA. specifically from its Isaac robotics platform. Isaac is NVIDIA's full-stack system for AI robotics. It combines real-time perception, motion planning, sensor fusion, and autonomous control, all in one platform. This allows NeuroBot to process its environment, understand spoken language, and make real-time decisions without constant human guidance. The robot is currently deployed at Taichung Veterans General Hospital in Taiwan. This isn't a test lab, it's a functioning hospital treating real patients. And Taiwan is not a random choice. It's one of Asia's fastest aging countries, projected to become a super-aged society by 2025, meaning over 20% of the population will be 65 or older. Hospitals in the region are already under pressure to do more with fewer human staff. NeuroBot is being tested as a direct response to that challenge. It's designed to monitor patient vitals using embedded sensors, assist with movement and mobility, navigate hospital corridors autonomously, and interact with patients using natural language processing. NeuroBot isn't replacing doctors or nurses. It's handling the routine, repetitive tasks that often consume valuable time. What sets it apart from earlier healthcare robots is its ability to learn and adapt, responding to patient behavior, physical layouts, and real-time conditions as they change. Real capabilities. Inside the hospital. Inside the hospital, NeuroBot isn't operating in a vacuum. It's doing real work, day to day. One of its core functions is vital sign monitoring. Using high-resolution sensors, NeuroBot can continuously track metrics like heart rate, oxygen saturation, and temperature. If it detects an irregularity, it flags it immediately. This kind of around-the-clock monitoring can ease the burden on nursing staff, especially during night shifts or in understaffed wards. The bot is also capable of autonomous navigation. It can move throughout the hospital, avoid obstacles, and reach specific rooms without manual control. Over time, it builds a map of its environment and optimizes routes based on usage patterns. In terms of patient interaction, NeuroBot uses natural language processing to understand basic voice commands and respond in human language. It can remind patients to take their medication, answer simple wellness questions, and provide a sense of presence, especially useful for elderly or isolated patients. When it comes to physical tasks, NeuroBot can deliver meals, distribute medication, and help reposition patients in bed. These may sound small, but they add up, especially in wards where nurses are stretched thin across dozens of patients. What makes NeuroBot especially unique is its adaptive intelligence. It doesn't just follow instructions, it observes and learns. If a patient routinely requests help at the same time every day, the bot can begin to anticipate that need. If someone moves more slowly or needs extra support, it adjusts its approach accordingly. This level of real-time behavioral learning is still rare in deployed hospital robots. All these functions are tightly integrated through NVIDIA's AI compute stack, which enables the robot to process sensor data, navigate space, and respond to human input, all in real time, without lag or remote processing. Early results and real-world feedback. The initial response from staff at Taichung Veterans General Hospital has been measured but positive. Nurses report that NeuroBot helps offload repetitive tasks, giving them more time for specialized care. Rather than replacing anyone, the bot is being used to extend the hospital's workforce in a sustainable way. Patients have described the robot as non-intrusive and helpful. Some noted that having it present, especially overnight, makes them feel safer, knowing that someone or something is always monitoring them. Although full clinical trial data hasn't been published yet, early internal assessments suggest the robot has improved routine task efficiency and reduced nurse fatigue. Importantly, NeuroBot operates under the supervision of human staff. It's not autonomous in the sense of making independent medical decisions. Every action it takes is still governed by hospital protocols. Healthcare leaders in the region are watching closely. If this model proves sustainable, it could be replicated in elder care centers and smaller clinics, where staff shortages are even more severe. Given Taiwan's rapidly aging population, scalable solutions like this could become part of standard hospital operations in the near future. Why? This is bigger than just one robot. NeuroBot might be the first of its kind in a real hospital, but it's not designed to be the last. What's unfolding here is bigger than a single deployment. It's a shift in how AI and robotics are entering high-stakes, human-centered environments like healthcare. This isn't just NVIDIA licensing a chip, it's an integrated system, hardware, software, and compute, built to handle real-time decision-making in a clinical setting. The platform behind Neurobot is part of NVIDIA's Isaac Robotics ecosystem, which enables robots to perceive, plan, and act in the physical world. It's being tested now in hospitals, but it's also built for broader use in industrial automation, logistics, and beyond. Foxconn's role is also critical. With its massive manufacturing capabilities, it has the infrastructure to scale production quickly if demand grows. Kawasaki Robotics brings industrial-grade experience in precision automation and robotic control systems, ensuring that the bot isn't just smart, but durable and reliable in complex environments. The strategic potential here is broad. If the model proves effective, it could be adapted for elder care facilities, rehabilitation centers, or home caregiving. The same core system could be repurposed for different levels of care with minimal retraining. In a 5 to 10 year window, systems like Neurobot could become a common fixture in medical settings, not as a novelty, but as part of the